Good morning, everybody. We are joined today by UnitedHealthcare for their fourth quarter updates. If you have a question, please type it in the question box and we will answer all questions at the end of the presentation. Be sure to follow us on social media and subscribe to our weekly Monday Minute newsletter for the latest Cornerstone carrier and industry updates. And Ed, I believe you're kicking this off for us.
Well, it's actually Colleen, but if you could share my screen, that'd be great.
Okay, Colleen.
Absolutely. All right, so while Ed brings us up, I just wanted to start with a thank you. My name is Colleen Renner, and I am the Director of Sales and Account Management for Ohio 2 to 50 business. And Ed, if you can just swap with your display settings. So as he's doing that here, again, just wanted to start with a thank you. Thank you to Cornerstone for setting this up, and thank you to all the brokers who have supported us and joined this call as well. We appreciate the partnership with all of you, and we're really looking forward to 1/1 and working together to sell some business here. So the focus on these slides, we're going to start primarily with the MEWA in Ohio. That's our main product. And we'll also go through our level funded for those that are in Kentucky and Indiana. And we have a guest speaker here to talk about a product that's coming to support us with called Mineral as well. Want to say thank you to all of our AEs that have joined the call and will be taking a turn to present. So we have Whitney Robinson in Toledo and Cleveland. We have Ed Lightcap in Cleveland, Drew Doherty in Columbus, and Mike Payton in Cincinnati. And then Josh Hoover from Mineral will be joining us as well. Before we jump into this, just a reminder that renewals will be coming out next week and the weeks after. So we're happy to work with you on any opportunities there, including ancillary, and looking forward to working on both of the new business and also the renewing business there. So as we start, I just want to give a quick update on the state of the MEWA here. So we just celebrated our 5th birthday this summer. So happy 5th birthday to the MEWA. We're actually we look at our closed numbers here. We can update this to 32,000 members and growing. So had a strong September sales month there. But we have strong financials. We have a healthy pool, and so we attribute that to our nurse liaison that you'll hear about later. But a couple of the pillars that we're really focused on here to give you an idea of our focus: improving access to care, reducing total cost of care, improving quality of care, and really providing those healthier outcomes. We know that health insurance is usually the #2 expense for these groups. We really want to help these members understand how to use their care and make sure they have the best plan available to them. So with that, to talk a little bit more about the MEWA, I'm going to pass it over to Ed.
Great. Thanks everybody for having us. I greatly appreciate it. I'm Ed Lightcap, small business, new business account executive in Northeast Ohio. I'm here to just talk about some exciting things that we're doing to not only make us more competitive, but make us easier to quote and sell. One thing I just wanted to kind of just mention is in 2024, we made a decision to increase our MEWA commission for the first 12 months to $40 per employee per month. We are going to continue doing that in 25. So we are going to pay that extra increase of 40 for the first 12 months for MEWA groups. So please take advantage of that. Another big thing that we're doing is, so about 2 years ago, we decided to underwrite groups with a member level census. We call it GRA underwriting. It has been really successful. A lot of groups that wouldn't have gone to market came to market. We were able to price them appropriately and competitively, and we sold a lot of business doing that. So we decided to, let's bring that down a little bit smaller. So as of today, we are actually doing member level census underwriting down for groups with 5 enrolled employees or more. So just to let you know how that works is basically you're working on an RFP, there's at least 5 enrolled employees or more, and the group has current coverage. If that's true, we do not need applications to underwrite the group. All we need is a member level census that includes things like first and last name, gender, date of birth, and home zip. And that's going to be for everybody enrolling. So that's why we call it member level census, because it includes employees, spouses, and dependents. But if we can get all that information, we could turn around, provide you an underwritten rate. And we're really competitive right now. And our installation does not need applications when we underwrite it without apps. So please take advantage of this. I'll tell you this, I have a number of brokers that are using this in two different ways. They're using it one way to protect their book of business and to make sure that they shop groups that maybe don't want to shop but can because they have a member level census, or people are using the prospect new business. We know that there's a lot of groups out there, whether they're transitional relief or not, that haven't shopped the market in many years. People are taking advantage of this, using it, and winning some decent amount of business. So please take advantage of this. We are quoting 1/1 effective dates right now, so please send in those RFPs as soon as you can. Now, one thing with our MEWA is it has a really small portfolio of plans. We've always had too many plans, too many plan types that confused our broker community. So the whole theme of the MEWA is let's do something that's easy and competitive. So part of that is having a small portfolio of 10 plan designs. We are basically for next year only going to be adding one plan. So as you can see on the right-hand side, 8 performance plans, those are PPO style plans. We're going to be adding a $1,000 deductible 100% plan for 25. To let everybody know, we added a 2,000 100% plan in 2023. That is now our top selling plan. So we know people are wanting these plans. My brokers have told me that they want richer 100% plans. And also this is going to go in line with a program I'm going to talk about a little bit later about targeting some grandmother, grandfather groups. Now, another thing about UnitedHealthcare you should be aware of for next year in 25 is we currently have a program called Designated Diagnostic Provider, where we tier our lab benefit. We are going to get rid of that program in 25. So the new plans will not have that benefit on it, and it'll just be like it was before. And then when a group renews in 25, they'll renew to a plan that probably gets away from that as well. So we just want to make sure that you're aware of that. And then the last thing really to point out is on the high deductible plans, the HSA plans. We are not allowed to, for 25, have virtual visits be $0 because of the IRS. So there will be a virtual visit cost share on HSA plans next year. And just to let everybody know, that will be $54. Again, we have a small portfolio purposely. I would say sometimes we threw too many plan designs at people and people didn't know what to look at. We know which one of our plans are most priced competitively, which ones perform competitively. So we just provide those plans, and everything seems to be working out in favor of everybody with having a small portfolio. Here's another big thing that we're doing. So this really applies to UnitedHealthcare, not just small business, but we're doing this change for small business. So we're allowed to, as a company, and so is every other carrier, we're allowed to determine what we want to use to determine size segment. So the government allows us to use AT&E, which is average total number of employees, which is what we use today. That basically looks at the previous calendar year and how many total employees you had on average. That includes full-timers and part-timers. So one thing that we've noticed is that there may be groups that maybe have 20 eligible, 30 eligible, 40 eligible. But when you count all the part-timers that they have, the AT&E goes over 51, and thus we have to quote it in the 51 plus market. We want to quote some of more of those groups in small business. So we are changing in 25 to what is called FTE, full-time equivalent. It's very similar to AT&E in the fact that it does go from the previous calendar year, and it does include part-timers, but it only includes part-timers as a fraction of the employee they are, not a whole employee each one. So there's going to be a number of groups that we previously probably quoted 51 plus that we will be able to quote in our 2 to 50 market with our MEWA, starting with 25 effective dates. So just let everybody know that, we're going to need that information to quote the group. So we're going to push back if we don't have the FTE in 25, just to make sure that we're quoting it in the right size segment up front. But again, this is going to allow us to quote more of those groups in the larger style, small groups in the small business with our MEWA. So we're really excited about that. Now, that also means since we're making this change, it impacts key accounts, 51 plus. So there may be groups that we currently have that are 51 plus because of the 18E count, and then they will be smaller in the 2 to 50 market because they're FTE count. If that winds up happening, we do send out surveys to groups. And your 51 plus strategic account executive, that's who helps you with your renewals, usually 51 to 100. They will still work with you on the renewal, but they just will renew it into small business and most likely into the MEWA. And then after that renewal has occurred, it will pass to small business. And then you will work with your small business renewal account executive on the next renewal. So there should be no change in who you work with on these renewals that are changing size segment. We just want to make sure that you're aware of it. Again, this is positive things for small business. We are going to be able to quote more groups and win some more business with you guys with our MEWA business. Another really positive thing that we're doing for new business is, we've always known that, some of our competitors did a good job of grandfathering or grandmothering their plans. So, when Obamacare passed 10 years ago, there was keep your own plan, and a lot of people have stuck on those plans in small business. We know based on filings that there's still at least over 100,000 members in the state of Ohio that are on these plans for the last 10 years that haven't made any changes. We know these plans run really well because we can see the financials of our competitors. So we've always been trying to think of ways, how can we get these groups to market? Because we know that after 10 years of incremental increases, even if some of them were small, the market's really caught up and a lot of these groups can now save money. So we put together a program, a pre-ACA program, where we are targeting some of those transitional relief groups. There does need to be some, we're not doing it for every group. So the group does have to have at least 10 enrolled employees or more to qualify under this program. The grandmothered or grandfathered renewal has to be 10% or less. So we are going to need a hard copy of that to prove that. We do have a census that you need to complete that's going to have information about, what their current deductible is, what their current co-insurance is, what their current out-of-pocket max is. We're basically going to take all this information, underwrite the group with a member level census. And for those groups that aren't those really high risk max loaded groups, we're going to basically offer you a MEWA quote that has at least a 10% decrement savings. Okay. It's going to be a 10% savings from our most similar plan. So it's not the plan designs we have, since we have 11, it's not going to match benefit for benefits. Sometimes we may be richer. It's one of the reasons we came out with that rich $1,000 100% plan, is because we know that some of the transitional relief groups have richer plans. But, when I say on there and the screen says you'll receive at least a 10% decrement, what we mean there is our underwriters may underwrite the group and we're saving them 15%. We're going to still save them 15%, send that rate out the door. It's just there may be a situation where maybe our plan's only saving them 3%. We're going to increase that decrement to 10% and send it to you. So again, I've never seen UnitedHealthcare do a program like this before. I'm real excited to be involved. It was actually test piloted in the Mississippi market, and it was extremely successful. So one thing that I will let you know, and most of those that are on this line here go through Cornerstone, so Cornerstone submits their quotes. But for you to actually use this program, we do have a separate and different RFP email address, and that's at UHC_SBS@UHC.com. So RFPs that are going to go through this program need to be submitted there. And in addition to that, since we're doing this program and we're looking to win some of this business, we're going to help you guys as well by paying a bonus of $150 per enrolled employee that are quoted and sold underneath this process. So great things. A lot of these groups haven't shopped in a while, don't know that they can save money. So we're just trying to make it easier. So please use this for any of you. If you have a book of business of transitional relief business, please give us a shot at that, because somebody else may try to quote it. If you're prospecting and you know of groups that are transitional relief, please, use this process to get a quote. Obviously, we're going to need those renewals. So, we ask you to hold on to those quotes until you get them. And then once you do, submit them so we can help you out here. So again, if you're going to have any questions, please let your Cornerstone rep know. Please let United Healthcare AE know. We're all here to help you guys to submit business, get it turned around quickly, and hopefully sell some with you as well. I did mention that there would be a spreadsheet you need to include that lists like the plan's deductible and coinsurance. That's what this is right now. We don't really need to go over it, but our underwriters are not familiar with all the different carriers' transitional relief plans. We're looking for you to complete this so you can help us steer what is the closest matching plan to give that 10% decrement from. So again, please take advantage of this program. If you have any questions, let us know. We're hoping to win a lot of business and make it easier. Again, this is not only for 1/1. So we know that their Medical Mutual, for instance, has monthly grandmother, grandfather renewals. It would work on one of those groups if it's an 11/1 or 12/1. Also after 1/1. So if we have a 2/1 or a 3/1, we can do this. As long as it's an upcoming grandmother, grandfather renewal, and you have a hard copy of it, we can do this program. Okay. That's it for my slides today. So I just want to thank everybody for your time and listening to us. I'm going to pass it over now to Drew Doherty, the AE in Columbus, to talk about some value adds that we have with our MEWA. Drew?
Yeah. Thank you, Ed. Can you hear me?
Yep.
Awesome. Yeah, good morning, everyone. I'm Drew Doherty. I'm the AE for Small Business Ohio in Columbus. And what I'm going to do is just go over, before I pass it over to Mike Payton, I'm just going to go over some of our main value adds that we have within the MEWA, both new value adds and existing from the start of last year, but just wanted a refresh. So we'll get started here with our health engagement nurse, who is Michelle Adams. She has been a nurse for over 26 years. She's our no cost dedicated concierge resource for our UHC members and groups in the Ohio Chamber benefit program. So what she does is she looks at that. When we look back at last year's filings, we saw 1% of our population is causing 40%, almost 40% of the cost. So what she's doing is going to that 1% and making sure that they're using all their resources to increase their employee health engagement. She's going to support the members with their health conditions, concerns, questions, goals, basically any questions that they may have regarding these high claimants or any resources that they may have. They can go to Michelle. And she also does outreaches to people with these high claimants to let them know, here's what you can use to maximize your Ohio Chamber benefits within the MEWA. And she also has these recordings that she will send out to newly implemented groups into the MEWA to make sure that they're aware of everything that they need to know within their health plan to help navigate their and stretch their healthcare budget. She is a reason why a lot of these renewals that we spoke about earlier are going to receive single digits from the back end. What she does really does impact the way our MEWA is priced. So she is available for our members to call, text, email with any non-emergency questions. She really is kind of the backbone of this MEWA. And so if anybody needs a flyer, we'll be happy to send this out with her information on it. Ed, if you want to go to the next real quick. So our new one of our new value add program is level 2. And what level 2 helps employers overcome the financial impact of type 2 diabetes. Ed, if you want to go to the next slide real quick. So when we look at claims data with type 2 diabetes, we see that 9% of people with type 2 diabetes among our UHC national accounts, almost 10% of people in our national accounts are living with type 2 diabetes, and that accounts for almost 20% of the medical costs and almost 27% of the pharmacy costs. Now, when this was introduced to the MEWA, we saw almost 1/3 of Americans, that's over 130 million people, either have type 2 diabetes or are pre-diabetic. So if we work in the small group business. If you have a small group of 3 people, odds are one of them is either pre-diabetic or type 2 diabetic. That is going to be a very large cost to that small group. So what is our solution, right? Ed, if you want to go to the next slide real quick. So we see these pharmacy trends. Yeah, there we go. Thank you. Yep, perfect. That is perfect. So when we talk about level two, this new program, level two is a virtual type 2 diabetes program where employees with type 2 diabetes, they will receive a no cost continuous glucose monitor or a CGM, and they will also receive a provider led care team that will help lower their average blood glucose, improve their condition, and even possibly pursue remission. So they have a whole provider-led care team full of registered dietitians, coaches, nurses, patient care coordinators, and providers that will help them drive better outcomes and improve their health, and again, even pursue remission. So as we see these people with these large claimants, like I said earlier, that 1% of the population causing 40% of the cost, implementing level two and having them be able to receive a CGM for no additional cost will then help, our big MEWA pool and as well as these employer groups help improve their costs within their groups. If we want to go to the next one real quick, Ed. So again, this is not entirely new. This was rolled out 1/1/24, but this is our vital medication program. These are 5 key medications that are totally $0 out of pocket. So again, life-saving medications, that Narcan nasal spray in the bottom right for opioid overuse, a glucogen kit, inhalers, EpiPens, and then that long list of insulins. And this is for ACA level funded and UHC MEWA. So this is in every program that we roll out in small business, and this is something to very much take advantage to, and as well as this is something our nurse liaison Michelle Adams that I was speaking to a little bit ago, she will let these at least these type 2 diabetics that are using this insulin or paying for this insulin, hey, you are able to get this for $0 out of pocket, right? Or this EpiPen that someone may already be paying for in their previous carrier, hey, you're able to get this $0 out of pocket. So we're providing vital drugs at the right cost is what we're doing with all these medications. So again, these 5 key life-saving medications for members are totally $0 out of pocket. We want to flip to the next slide. We'll go over our UHC rewards. Again, this was rolled out within the MEWA for 1/1/24, but this is, in my opinion, the easiest way for a lot of members within the MEWA to earn some additional dollars back to pay for any out-of-pocket cost or anything they'd actually like to pay for. So what we're looking at here is in our 8 PPO plans within the MEWA for 1/1/25, our core UHC rewards is embedded, which is an annual, a maximum annual incentive of $300. So that yellow column, that where it says core, that's embedded into our PPO plans. And then on the other side, the premium, that orange column, that's embedded to our 3 HSA plans. So what they'll be able to do is, one, complete activities, daily activities, like we've had in the past with Motion, where they're still able to complete those daily activities and earn a daily rewards dollars. You'll see they just automatically track activities and connect the tracker. They earn up to $65. But what we implemented, other than just the Motion and the daily activities, is completing surveys and annual blood work and getting an annual flu shot. They'll actually get money for that as well. And that once that claim processes, it'll automatically be able to be added to their UHC rewards on their app. In previous years, it was a separate app. It was a separate login. It caused confusion. Not as many people were utilizing our rewards programs. Well, now this is on the same app as they will see their benefits. Actually, on the app, you'll see, look at plan design, and then under that, it has UHC rewards. So it's super, super easy to get to. And it's also very easy to take your reward dollars out. If you have at least 5 rewards dollars in your UHC rewards, either core or premium with the PPO and HSA plans, all you need is $5 in that account, and you'll be able to take it out using a Visa digital gift card. Or if you have an HSA plan and you have an Optum HSA bank, you'll be able to take those rewards dollars out that way as well. We do not have third-party HSA banks right now for our HSA plans, but if you have an Optum HSA bank, we will be able to take it out that way. So again, a super, super easy way to earn these rewards dollars. I know last 1/1/24 when we rolled this out, a gentleman came into the MEWA that I knew, and by the end of January, he started for 1/1/24, and by the end of January, I was talking to him because I was curious how UHC Rewards was working, and he already had over $130 earned in 1 month with UHC Rewards. So it's easy to rack up those rewards dollars for just completing daily activities and pay for any out-of-pocket costs that these members may have. So go to the next slide, Ed. Next, we're going to touch on our gym membership program, One Pass Select. So if you get asked about a gym membership program or what does UHC offer with the gym membership program, we have One Pass Select. So what this is it's a variety of employee membership options, right, to fit your lifestyle goals. So we have digital, classic, standard, premium, and elite. What does that mean? There is different categories that you'll be able to pay. All of it's a $29 enrollment fee except for the digital. And then you can see as the tier increases, the standard, premium, and elite, the monthly fee goes up. Now, to give you kind of a visual representation, we'll go to the next slide, Ed. This is what those tiers look like. So if you enroll in the classic, which is a $29 enrollment fee and a $29 monthly fee, you'll get access to all those gym memberships anywhere in the country. So if you're traveling or it's right near your house here in Columbus or anywhere you may live or travel to, and you want to go to an LA Fitness or a Planet Fitness, you'll be able to if you're a part of that classic tier. Now let's say you choose standard tier, which is $64 a month, $29 enrollment fee. You'll have access to all those and then everything on the left-hand side. So if you choose standard, you'll have access to classic and digital as well. One thing I do love about this is when we were just talking about UHC Rewards, you'll be able to pay for one pass using your UHC Rewards dollars on the app. So essentially, you can get all these gym memberships for free. If you want to go to the next slide. I believe that's all I have on value adds. Again, if you need any flyers on these to show to your groups, please don't hesitate to reach out to any of us. I truly appreciate your all partnership and looking forward to a great one season. I think I'm going to pass this off to Mike Payton down in Cincinnati.
Perfect. Good morning, everyone, and thank you, Drew. For those who don't know me, my name is Mike Payton. I'm your UHC Small Business Account Executive here, located in Cincinnati. And I'm going to kick things off here with UHC ancillary package discounts. So if you have a group that has UHC MEWA, ACA level funded, especially on the new business side, and we look really good in the medical, we do have a package savings program that we actually had for last year and earlier this year during the summer and actually expired. And so we're bringing it back here for fourth quarter and for 1/1/25. So if you have a group, again, new business, UHC level funded, ACA, or the UHC MEWA, we have a discount called Advent Savings, where if you have a group that has dental with 10 or more enrolled employees, and they also have they add one more line of coverage with 10 or more enrolled employees. It could be base life, it could be short-term, long-term disability, or even vision. We're actually going to provide this group with a $50 one-time admin credit of $50 per enrolled dental employee. So again, if you have a group that has 10 or more enrolled employees, they also add one more line of coverage. It could be base life, it could be dental, or vision, or short-term, long-term disability. We'll provide the group with a one-time admin credit of $50 per enrolled on the dental. The admin credit will appear on the 5th or 6th invoice of the for the group. So if you have any questions, just reach out to your UHC account executive. But one thing to point out, especially here in Ohio, is on the MEWA, we do provide proactive base life, dental, and vision quotes. They are our most popular plans that we sell today, but also note that they are also pretty much manual rates. If you need us to match plan designs, get a little more competitive, you can work with your UHC account executive, and we can actually match the plan designs and provide some additional discounts for you. So it's a good opportunity to package everything with one carrier. Next slide, please. So let's everyone now take off our MEWA caps and let's focus on UHC level funded. So as a reminder, in the state of Ohio, the UHC MEWA is our only underwritten product available. But for groups that are outside of Ohio, in particular, I focus here on the Kentucky, Indiana market. There are some key updates I want to review with you for Kentucky and Indiana in particular. So the first thing for UHC level funded Indiana and Kentucky is the participation has been updated. So in the past, it used to be 50%, but now it is 50% after valid waivers. So I think that's a huge upgrade. So if you've got a group that has, they may not be reaching the participation this past year or previous months, you can give us another opportunity to quote that group because we just require 50% after valid waivers. When it comes to quoting, we also make it easier, just like Ohio. So every state in the United States, or every state in the U.S., has pretty much gone down to 5+ enrolled GRA member level since underwriting. There are a few states that still have not transitioned to that, but really the states that surround Ohio are now 5+. So if you have a group with 5 or more enrolled employees, it excludes virgin group, so they must have group coverage today. You can just send us that RFP using that member level census, and we will provide you with an underwritten quote. So just a good opportunity here for fourth quarter and 1/1. We don't require the renewals, so we do ask you to include the renewals in your RFP. If you have not received them yet, please forward them to your AE, UHC AE, as we like to just kind of review the renewal, take our notes, and we'll provide you with some recommendations on plan designs. Also for UHC level funded, there are only a handful of states that are participating, but for Indiana and Kentucky, we are offering the 12 or 15-month rate guarantee. So now through 1/1/25, you can choose between a 12-month or a 15-month rate guarantee. If you choose the 15-month rate guarantee, there's no additional cost. So it's the same cost. The rates don't go up. We just ask for when a group is sold to fill out either a 12-month or 15-month rate guarantee document. And then also for the state of Indiana, for all new groups that have 10 or more enrolled employees on UHC level funded, again for Indiana only, we are for 1/1/25 providing groups with a one-time admin credit of $400 per enrolled employee. So again, Indiana level funded only, 10 or more enrolled employees, we are providing a one-time admin credit of $400 per enrolled employee. Next slide, please. There we go. So something that's actually new that just launched this week is it's for UHC level funded only. It's another package discount program for ancillary and medical combined. So again, UHC level funded only. It does not include ACA. It does not include the MEWA. But for groups that are outside of Ohio, UHC level funded, we are now providing groups with another package savings that's called U Bundle. I'm sure you guys may have heard this in the 51+ space, but we are now bringing it down to the 2 to 50 space for UHC level funded only. The way it works, it's very easy. If you have a group UHC level funded with 5 or more enrolled employees, we give you the opportunity to bundle your ancillary, and you can actually receive a discount up to 4% on your UHC level funded medical premium. It's very easy. So as you see on the screen here, let's say you have a new group with 5 or more enrolled employees. We look good in the medical, but you know what? You just want to take some advantages of our package savings and get a little more competitive. If you have a group that has dental and they do write it with UHC, we'll provide 2% of medical premiums or savings off the medical premiums. If you go to the next slide, please. There are some qualifications when it comes to U bundle. So for example, when I said the dental can be contributory or voluntary, but we do require 50% participation on the dental. So vision requires 50% as well. And you can see on the screen here, every line of coverage has their own participation. But again, you can, if you were to write UHC level funded, and then you add ancillary, and they do qualify with these participation requirements, we will provide up to a 4% discount off the medical premiums. I think it's just, I couldn't be any more excited about this because in the past we've never had a discount program where we can take money off the medical premiums. It's always just usually an admin credit. So what's nice about with UHC bundle is that it's an opportunity to take money off of the medical, but also just remember we do also have activate the savings that I discussed earlier. You can actually double dip as well. And we do have package savings for UHC level funded as well. So we have multiple options that will all work together. I know it may be confusing, but my recommendation is, hey, work with your UHC account executive, and we can provide you with the appropriate details and give you a quote on the dental and vision in particular, or even short-term, long-term, or life. Next slide, please. Something that we're actually very, very excited about when it comes to UHC level funded, right? So UHC level funded, and when it comes to the reporting, it can be very time consuming for groups to file the 1095 Bs, Cs, or 1094 B and Cs. We've listened to a lot of feedback, and I understand that a lot of my competitors may offer something like this, but when it comes to UHC level funded, today groups have to file their own 1095 and 1094 documents. Well, here's a great opportunity. Effective 11/1, UHC is now partnering with a company called Mineral. And today on the phone, I have a gentleman named Josh Hoover from Mineral, and he is going to provide you some details of Mineral and how groups Mineral is going to file these forms on behalf of the group. Josh, you want to kick things off?
Excellent. Thanks, Mike. I appreciate it. And I'm excited to be here this morning to share what all we have going on. Like you said, my name is Josh Hoover. My whole role here at Mineral is my title is Enterprise Partnership Manager, but I support the UHC relationship. So I'll be the day-to-day contact. Here's my email address if you need that. But I want to give you a little bit more about who Mineral is and what we do before we dive into the actual ACA component. We'll cover that in more detail here in just a second. But on the next slide, it shows who Mineral is. So we are an HR compliance technology solution. And so we have over 60 certified experts. And by that, I mean PHR, SPHR certified individuals that they are your client's phone a friend. And so if they have any HR related challenges that they want to talk to somebody about, they can phone a friend. And we've got 60 full-time employees that can help support that, whether it's compliance, whether it's law alerts and all that. Those individuals are manning that phone bank, and usually within about 60 seconds, they can get a live person, which is fantastic. Now, I did mention we are a technology solution because all of that information is also available on inside our system, inside the platform. So they log in. All UHC level funded clients will have access. They can just log in and get those questions answered within the platform if they want, or they can call somebody first if they want. Doesn't matter to us. We're here to support. But there's a lot of other solutions within the system. Mike mentioned the ACA component, which, like I said, I'll talk about here in just a second. But we also have an LMS, a learning management system inside the platform with well over 300. I think it's closer to 400 or 500 classes, whether that's around safety training, workplace harassment prevention training. Certain states require the workplace harassment training. And so that could be very key. In fact, we had a client just a couple of weeks ago who they were about to spend like a 30, 40 employee group, small group. They were about to spend $30,000 on a brand new LMS. Well, turns out they already had access to Mineral and had in our system had everything they needed. So they didn't need to do that. They already had access to our solution. Another one is the documents creator. This is big, particularly when trying to create those ERISA, RAP, and POP documents. Within the platform, those documents can be created automatically. You have to plug in certain plan information, which is key. I mean, that's what those documents are based around. But the system will create those documents on behalf of the employer. I'm going to skip a lot of that because a lot of the rest of these bullets because they're pretty self-explanatory in the system, but I do want to highlight the employee handbooks. This is a big one, especially if you have clients that cross state lines. You know, Ohio, Indiana, Kentucky. Each state has different requirements for an employee handbook. So within the system, an employer can create a handbook very, very easily, and it customizes to that client and their states that they are in. So very comprehensive. But I do want to talk about on the next slide. Let's dive into what the ACA solution looks like, because the biggest challenge when it comes to level funded is that transition to be having to file ACA reporting requirements. Well, is it about 8 years ago when everybody was panicking because of the ACA requirements and the 1094, 1095s? Well, we've solved that problem for those clients. So they will be able to get those forms created and distributed through our system. There's a lot of nuance that goes into it, so I'm not going to cover this line by line, but I want to just walk through on the next slide a workflow of what that actually looks like when a client needs to comply with ACA reporting requirements, which is all level funded clients. So, and if you go to the next slide, there's a workflow. So when you start this, on the left is the client will have to complete an ACA reporting questionnaire. It's basic questions. They're going to know the answer. If not, they talk to the owner of the business and they'll get those answers very, very easily. It's do you agree to file your ACA through us, or do you have another solution? If an employer has another solution for ACA, that's fantastic. We just want to make sure they've got a solution in place. There's a couple other nuances around it, like being part of a control group, which changes reporting requirements very slightly. The client doesn't even really notice, but we have to use that to make sure that the client is completing the correct forms. So there's that intro questionnaire, should only take a couple of minutes. And then they go into the ACA reporting tool itself. So in the questionnaire, it will be determined whether they complete the 1095 and 1094B forms or C forms. It's kind of a little choose your own adventure. The B forms are pretty simple. A lot of the information will already be in the system during setup and implementation. The C forms gets a little bit more complex because this is where the affordability component comes in. We have to get information from the client's payroll system to make sure that plan is affordable. The Affordable Care Act wants plans that are affordable for those employees. So what will happen is we'll have a template, basically a spreadsheet template that the client will have to complete. Realistically, within QuickBooks, ADP, Paylocity, ProLiant, whatever payroll system they have, they should be able to pull that report and complete that template very, very simply. And so that shouldn't be a problem at all, especially now that ACA has been out for a long time and people know a little bit more about what they're doing. If not, if they need help, we have those 60 experts that they can call and we can walk them through that process. So they complete that template, upload it in the system. Then the final thing that the client will have to do is they'll have to review the forms to make sure they're correct, because ultimately the client owns it and has liability for it. So they want to make sure they're validating the forms. They review the forms, they hit submit, it goes to our system, or it stays in our system and then goes out to the IRS. And then the first year, we're actually going to print and mail the 1095s. But after this year, after 2024 or 25 filing for 2024, after that, we will almost certainly be doing all of that electronically, but we're still building that out. So we'll see how that goes. But we'll submit it to the IRS. We'll distribute to the employees themselves. All of this takes the massive burden off of the employer. It drastically simplifies this. And like I said, if the client has questions, they can easily call one of our experts and get the answers that they need. The last thing I want to highlight on the ACA component here is it's on the next slide. It's when determining affordability is there's different safe harbor methods that the client can use. Well, when they upload that template from payroll into our system will walk through which safe harbors are possible or usable for each particular class of employees. So you have the W-2 safe harbor, rate of pay, or federal poverty line. And so in this particular screenshot, this client complies with W-2, complies with rate of pay, but does not comply with federal poverty line. So in this case, you'd likely want to use the rate of pay safe harbor to make sure you're in compliance. If you're not in compliance with all three, then we have to go back and rework some things and make sure that those plans are affordable. So all of that is something that we can help with. We'll work with the UHC reps, we'll work with the brokers to make sure that everybody is in lockstep and we're all singing from the same hymnal and moving the right direction. So again, in conclusion, Mineral, we're HR technology compliance solution. So any compliance related challenge that your client may have, they can get answers in the system, or they can call our phone a friend in those experts. And then ACA, we're solving that problem so that the end of year reporting for ACA, that gets done and distributed and done correctly, which is something that I know a lot of employers have really struggled with over the last few years. So that concludes my portion. If you have questions, feel free to drop it in the chat, and I will punt it over to Whitney.
Awesome. Thanks so much, Josh. Really appreciate it. And again, my name is Whitney Robinson. As Colleen mentioned, I cover the Toledo and part of the Cleveland space for 2 to 50 with UHC. Just a little bit about me. I started here in the 2 to 50 space, but the last year I've spent in that 51 to 99 market and key accounts as well. So I was able to take a huge focus on selling our product here, Surest. I'm sure many of you have actually heard about this, maybe seen a short webinar on it, or maybe you've even gotten into it in the 51 to 99 space. But we're super passionate about Surest as a company. Surest is a United Healthcare company, and we're just very passionate about it as employees as well. I've actually been a member of Surest for 3 years now. So I've had some really great experiences with it as a member, and I'm just really excited to be able to sell it now. So this was another really big, exciting thing for me coming back into 2 to 50, that we are going to be offering Surest next year. So our goal is to offer a few Surest plans within the MEWA, and that will be, we're going to look at 5/1 of next year. That is subject to change as we're rolling this out and getting everything set with Surest, but we're looking for it at our big next effective date as of 5/1. So I just wanted to highlight a few things about Surest, give you just a brief overview of it. We're going to spend a ton of time doing demos and in-depth meetings on this with you, with your clients. We want everybody to feel super comfortable and really know and understand what Surest is. But where I want to start is, it is a United Healthcare company. The Surest product is on our broad access Choice Plus network, which is awesome. Every single hospital system in the state of Ohio is in network in Choice Plus. And as I mentioned, in large group, it's in the fully insured space and self-funded space right now, and we're having huge growth with this product. What I want to mention is, the greatest thing about it is there's no deductible, there's no co-insurance. This is a product that is only copay based, and there's an out-of-pocket max in place. And I'll get into that a little bit more on the next slide. But I also wanted to highlight the growth. Right now we're at 710,000 members, and after 1/1/25, we're looking for that number to be about over 1 million. We've been calling out some of these big clients like Best Buy, Culligan, as I mentioned, United Healthcare. These are all some of the big clients that we've been looking at in 2024. But what's really exciting for 2025, we already have Yamaha, Microsoft, Google, these huge companies across the country. They are offering Surest to their employees. I actually had my sister-in-law reach out to me. She knows what I do for a living. I talked to her a little bit about Surest when I saw her last, and she said, hey, is Surest that product that you were talking to me about? She works for Thomson Reuters, another huge company, and she was super excited to be offered it for January, since I really got her excited about it and told her about my personal experiences. You can go to the next slide now, Ed. So a little bit more about the product. So this is an example of the app. Surest is built on an app, and you can get on an online portal as well. And what's awesome about it, it's all about transparency. Healthcare is really one of the only things that we go into a doctor's office. We don't know what we're paying. We don't know what bills we're going to get. We just kind of walk in with our ID card, and then we're set bills, and we have no idea. So, and a lot of us, like me, I do a lot of online shopping. I price check things. I'm on Amazon all the time. Surest is really going to give you that Amazon-like shopping experience for your healthcare, and you're going to get full transparency and know exactly what you're paying for your doctor's visits, your procedures. Maybe you're having a baby. You want to know what you're paying, and that's what Surest is doing. So an example here, you can just type in sinus infection. What's great about the app too, you can put things in layman's terms. You can just type in having a baby, and it's going to show you what you need. So it's really, really easy and intuitive. If you have any troubles, the awesome thing is you can call in to our boutique style service that we have within Surest, and there's people behind Surest that are actually going to walk you through how to use the app, or what does this procedure look like. I actually called in about 2 weeks ago. They walked me through exactly what my copay was going to be for a procedure. They called my doctor's office. They got the billing code. I just wanted to double check and know exactly what I was paying, and those people were there to help me. On that second little screenshot there, you can see when you look up that sinus infection, you're going to get that virtual visit option first, then medical office visit, then urgent care. What we're doing is trying to get members to the right site of care for what their issue might be. So something like a sinus infection is super simple. You could do a $0 virtual visit through Doctors on Demand and pay nothing. So we're always trying to push members to what's going to cost them the least. then maybe you really want to go into your medical office visit, or maybe it's the weekend and it's a severe sinus infection. You got to go to an urgent care. We're going to highlight the urgent care visit there as well. And then also you can see the doctor screenshot there. We're going to also show you what doctors are available. We're going to give you reviews on doctors. What are people saying about those doctors? We also measure them ourselves with all the technology behind Surest for quality and cost efficiency. So if you're familiar with our premium designation program, that's built into our performance plans. It's kind of like premium designation on steroids with Surest. We are rating every doctor, every hospital system. We're looking at the full episodic cost of care. So what is that doctor doing? Are they taking somebody to physical therapy before taking them right to surgery? If they are getting a surgery, what's the outcome of that surgery? So we are fully rating these doctors and trying to get members to the best doctors possible. And then there's just a screenshot of the bill. You can do it paper or paperless, but you're going to get that one all-inclusive copay sent to your door and know what your responsibility is to pay. So there's a lot of transparency behind it, and that's what I love personally the most. And then if you want to go to the next screen, Ed, I want to just show you a quick screenshot of one of our plans. There's a lot of different plans. We'll see what ones we're going to be getting on the MEWA, but this was a really popular plan that I was selling in the 51 to 99 space. This is our C5000 plan, and it's so simple. It is a little bit different than your typical plan that you're putting on a spreadsheet because there's no deductible and coinsurance. But what's great is those are completely removed, and we're only taking a look at the copays here. So all of your preventative care is actually covered at $0 cost with Surest, which is huge. And office visits, each copay varies, as you can see. You have choice. You can go to your current provider that you maybe don't even love today, and maybe it's a $55 copay, but then you can get on the Surest app, look up doctors and PCPs in your area, and find somebody as low as $15. But you still have that choice to go to whoever you'd like. When it comes to urgent care and emergency room, this is a huge question that comes up. We do not expect members to shop for care and search on an app when they're in an emergency situation. So there's just going to be flat copays for urgent care and emergency room. Another huge piece of this, I already kind of mentioned, is maternity and delivery. When people are having a baby, obviously that is a very stressful time. They want to focus on having the baby. They don't want to focus on how many bills am I going to get. This is so stressful when people get constant different bills. They don't know what to pay. With maternity and delivery, all your prenatal and postnatal care is covered at $0 cost with Surest. And you can have a baby on this plan specifically for as low as $900. So that's huge. Every time I'm talking about that, there's always somebody that raises their hand and say they just paid $8,000 to have a baby. They would have loved to have a plan like this in place. And then I'll also mention too, each procedure is different. So you can look up lumbar spine fusion and you can see that might cost $1,500 or up to $5,000. You're going to see what that copay is going to be based on what hospital system you go to. But when you're in the demo and actually looking on the Surest app, if that lumbar spine fusion pops up, you're going to be able to see every single line item that is included in that lumbar spine fusion. So the anesthesiologist, the room and board, everything is all included. And it's great to see that the line item list of what's included in that one copay. And then last, the prescription drugs are actually included within Surest as well. So you can look up amoxicillin and you can see that that's going to be a $10 copay, for example. And you can see every single place that you can go, whether it's CVS, Walgreens, local pharmacy, they're all going to pop up kind of like a Google Maps type style pop up on the app. So as you can see, it's super easy to use Surest. We're really excited to take you deeper into this product come 1/1. I'm sure we're going to be doing a ton of meetings and education with you and your clients come 1/1 because we're trying to focus on that 5/1 effective date for Surest. And as you can see, I'm super passionate about it. I've had a wonderful experience having it for my own personal healthcare. And we're just excited to do a little bit more with this in the new year. So with that, that is all that we had today. But in closing, I just wanted to take the time to thank you all again. We just really appreciate your time during this busy time. This webinar is actually going to be recorded and it's going to be sent out to you within 1 to 2 business days. So you can go back and listen to it or send it to people that weren't able to join today. But just wanted to highlight a couple of things. Just make sure you're quoting your 1/1 opportunities early. We have over 10,000 quotes or members quoted right now. So we're really excited about quoting early, making it easier for all of you for quoting and implementation. And, our biggest ask, obviously we want to sell with you all, but our biggest ask is to quote as many groups as possible by using this member level census underwriting. And it's just a really great way to win new prospects as well. And I also want to mention that we've got about 5 minutes left here. There is a chat feature in the upper right-hand corner. We're all going to stay on today for a few minutes to answer any questions. So feel free to put those in the chat. We'll wait here for a few minutes and go ahead and answer any questions you might have.
Thank you, guys. I don't see any questions currently. Nothing in the chat. Are we going to be able to get copies of the slides?
Yep, we should be able to send that out to you. And we've got some updated flyers too in regard to everything that was talked about today, like the transitional or the pre-ACA program, and then the level 2, things like that.
Perfect. That'd be great.
Awesome.
Well, still no questions. I say if anybody has any questions, feel free to reach out to your broker advisor at Cornerstone, and we'd be happy to get you some answers. I think that's it. Thank you, UnitedHealthcare.
Awesome. Thanks so much. We appreciate it.
Thanks for your time,
All right, you guys
everyone.
have a great day.
Thank you.
Thanks all.
Bye-bye.